ciclo de entrevistas del Consejo Argentino de Oftalmología, en el cual estamos dialogando con colegas de distintas partes del mundo, en donde la pandemia por coronavirus llegó antes. Y así poder aprender de ellos qué medidas han tomado para organizarse y enfrentar mejor a esta pandemia. Hoy tenemos invitado al doctor Luis Tong. Él es Senior Consultant del Singapore National Eye Center. Él es un investigador clínico científico principal y es el responsable de the Ocular Surface Research Group del CERI, Singapore Eye Research Institute. So Singapore is doing a very well job facing this pandemic, as we can see by the numbers. What could you tell us about what Singapore is doing to face this pandemic?
Well, I think this is largely a whole of the country effort. It's not only just the healthcare system. Of course, the healthcare, people are in the front line, the doctors at the hospitals, as well as the clinics, the primary care clinics, as well as the people with the immigration. And the only way to come up well is to have a message that's like a believable and transparent for the community and for everyone to support each other. I think the peculiar things in Singapore that you notice that are probably a bit different from other countries are how calibrated the response is. In other words, it is not like a sudden shutdown or a sudden we don't deny that there is an outbreak and pretend it's not there. But on the other hand, we just shut down all the schools at one shot or something like that. So it's all very calibrated and according to the evolving situation in the world, as well as the surrounding countries, and as well as the numbers of the patients that are reported and coming in. And so it's a lot of monitoring, a lot of looking at the evolving evidence and trying to react almost on a daily basis. In other words, in a weekly big decisions on a weekly basis, and tiny policy changes and monitoring the actual problem on a daily basis actually. So we have a very detailed report of what is going on, how many people are on home leave, how many people are affected, and so on. So this is to summarize how we deal with this.
Can you go a little bit in more details of what measures are you taking?
The situation, the geographical situation, and also the state of the infection and the readiness is quite different from place to place. In Singapore, we have this system of alert. We call it a DORSCON status. So it was a yellow status in January when we know there's a outbreak going on in China and starting to spread out. We then rapidly in February, on February the 8th, we go into the next highest level, which is the orange status, which remains to today is still orange, but the measures within orange have been escalated within this ban. And we were quite lucky in the first 2-3 weeks and even a month in that phase 1 of the outbreak, where most of the cases are still in China, and we got a few infection, and then we could keep it under 100 cases at that time. So that sort of goes quite well. But then later on, what happens is because of the cases in the UK and the Europe and the cases in US and Singapore nationals are gradually coming back from different places, and there's a high proportion of infections in these people that are coming back. So we started to get numbers every day of about 40, 50, 60, and at one day it was 70 people. So now it's back to about 40 or 30 something per day. Hopefully it stays like that, but this is only the second phase. So we are all the time ready that there could be very well a third wave, considering that there are many countries around Singapore, for example, Malaysia and Indonesia and Philippines, that have not very thorough monitoring, and they could, eventually come back again as a third wave. By now, we have stopped all the other nationalities from entering Singapore. If you're a long-term work pass holder, it depends on the industry. If it's a critical healthcare-related industry, you might be let in. Regardless of the country now, we have to be a 14-day observation. So they call it stay-home notice, and that's very strict. For example, you may have video cameras, you may have some ways to monitor your whereabouts, and you may have to confine yourself really to home and rely on others to give you food, for example, right? So it's a very strict home stay home notice. So basically, out of the total of 879 yesterday night, right? The 228 have recovered, and out of the 228, there's just another additional 228 that were that haven't recovered, but they were mild, so they will not use hospital facility now. They were moved out to the community isolation facilities, and also to 2 private hospital wards. So these are not homes. So these are people who were infected by very mild disease, but could still possibly spread out. They still haven't got a negative swab. So these people are not occupying spaces, important isolation rooms in your hospitals. Now, the others are mainly in the National Infectious Disease National Center for Infectious Disease, where most of the cases. We don't encourage everyone to go to the hospitals. In other words, if you have fever, if you have flu, there are still plenty of people who have flu and unrelated to the infection, and they should be seeing the general practitioner doctors or the polyclinics in the community. So these, the bulk of these people so far, they are not able to do the confirmation test for the disease. So if you have a low risk situation, if you suspect it's just a mild fever and a cough that's not related to this, there's a list of suspected criteria. In that list of suspect criteria, you can be going home and stay for medical leave for 5 days. So 5 days is assuming that they are not likely to be a COVID, right? So there is a talk of what happens if at the end of 5 days you still have symptoms. So what the GPs or the doctors would do is now very likely that at day 4 or day 5 they can do a serology. So serology is different from the standard PCR. So if the serology is negative, they could probably just go back home for another 5 days of rest, right? If serology is positive, of course, you'll have to go to the NCID for for a proper swab and a diagnosis. So the bulk of the patients are they are not handled at hospital, but still there's a huge load of people at hospital, because when you hit the 5 days and then when you have a situation where you don't have the serology, then there are some borderline cases get sent to the hospitals or the other sources. Of course, the people who are stay home 14-day notice, if they should develop some symptoms, then it might be not advisable for them to go to the doctor's clinic. So what they do is they have special ambulance or special transport to bring them from their home into the NCID or the hospital for testing. So the emergency departments are kept relatively free, just to prevent the suspected cases from going there as the first resort.
Yes, I can figure that out. And how does the state know when someone is not staying at home while he should, for example?
There's a lot of ways. They don't rely on just one method. Mm-hmm. So one of the methods is the phone app, for example, your phone location, that they can find out where you are. The other is the constant calling. Some people will be texting you and calling you and finding out where you are. And sometimes you may even have to, if you miss 1 or 2 of these phone calls, you may have to actually show a video of your background and your watch or whatever to show that where you are. And sometimes they have even surprise unannounced visits to your house. to make sure that you haven't moved out or you're still there. So there's a couple of different kinds of measures that are going on. In the SARS period, I think people were even using trackers like radio frequency trackers and stuff like that. But that's a bit more tricky because you need to have transmitters. It's a very big offense if you break the rules for this. You could be jailed. And there's also a big offense of people who don't report honestly your travel history, for example, and things like that. There were a few foreign workers with their work pass permanently cancelled, or or even the permanent residents who got their passport cancelled or withdrawn or something because of dishonesty at the level of the the history, the filling in the form and so on, the declaration. So they're pretty strict about those things. But they don't stop you from walking around without a mask, for example. If you're walking along in the park without a mask, no one's gonna tell you that you have to wear a mask, right? Yeah.
Right. And especially at your hospital, how did things change?
So in the normal clinics, we still use generally the surgical mask rather than the N95 mask. So the surgical mask, and we don't gown. For the gloves, it depends. Some doctors wear gloves, but some doctors just wash their hand every single case before and after, or use the hand scrub before and after. Of course, you're going to be a bit slower if you don't have a typist or you have a scribe at a computer, because you're going to then disinfect your hand, right? And then you're going to touch the keyboard. So then the slit lamp will be cleaned by the nurse, for example. So things has to be very systematic and slower than usual. So now we have to reduce the numbers that are seeing the clinic rooms in order to make sure that the waiting area doesn't get crowded. So if you have a chronic case, you may have to see them longer, right? Normally, if you ask a patient for 4 months, maybe now it'll be 6 or 7 months. And then the medications will be transported through couriers from your pharmacy to the patient's house. So they don't need to come back just to collect medication. We are also into 2 teams. So if you are not in the same team as me, we're not supposed to go to the same room for lunch, right? So different teams will go to different places for lunch.
Are you checking through PCR the corneas that you use for the graft?
There's no added measures in this period in terms of what you test for the donor graft. But they just stop you from doing it basically unless it's a real emergency that you have to do it. So basically the cases are very low.
You using telemedicine?
We don't do any special new telemedicine in this period, but Singapore has quite a lot of telemedicine even before the outbreak. For example, there are teleconsults that the patients can ask GPs questions, and they can get simple medications and Panadol and stuff through the internet web conference and so on. For ophthalmology, we have some special telemedicine, like certain types of glaucoma cases or certain. I mean, diabetic retinopathy has a national screening system through the photo. They even talk about AI and all sorts of graders looking at the photos that are taken at the polyclinic. So basically, there's no new telemedicine that started because of the. I think the issue is how to deal with the cases of suspects and those who are how to differentiate them from the flus and the normal cases.
It was an honor to share this morning with you. So thank you very much for your time and for all the specifications you gave us. Thank you so much, and we'll be in touch.